Welcome to my channel. Subscribe or dale like if you like it. Today we will explain the Cytotec drug. We will talk about its side effects, its dosage, contraindications, warnings, its mechanism of action, pregnancy, breastfeeding and much more. What is Cytotec? Cytotec is a semi-synthetic analog of prostaglandin E1, PGE1, used for the prevention and treatment of gastric and duodenal ulcers. It is also indicated for labor induction, for the practice of abortions in certain countries and for the treatment of rejection in transplant recipients. Here we will discuss the use of Cytotec in gynecology. What is the use of Cytotec? Cytotec, in the form of a vaginal insert, with a controlled release mechanism, is indicated for induction of labor in women with or near-term pregnancy. It is also used, in some countries, for medical abortion, specifically for induction of labor and, in combination with other drugs such as mifepristone, for voluntary termination of pregnancy. The active ingredient of Cytotec is misoprostol. Cytotec's mechanism of action. It induces contraction of the uterine musculature, acts as a blood vessel dilating agent and as a mild bronchodilator on the bronchial smooth muscle fiber. It also acts on the gastrointestinal tract by inhibiting acid secretion, acting directly on gastric parietal cells, decreasing pepsin production, stimulating duodenal bicarbonate secretion and increasing gastric mucus production. Therapeutic indications of Cytotec. Cervical maturation and induction of labor at term, especially in cases of immature cervix as long as there are no fetal or maternal contraindications, 25 micrograms. Dilation of the cervix of the non-pregnant uterus prior to hysteroscopy or other gynecological procedures requiring access to the uterine cavity, 200 micrograms. Vaginal release system 200 micrograms, induction of labor in women with an unfavorable cervix, from the 36th week of gestation, in which induction is clinically indicated. Side effects and adverse reactions of Cytotec, in gynecology. Vaginal tablets, nausea, vomiting, diarrhea and abdominal pain. Vaginal release system, fetal heart rate disorder, abnormal delivery affecting the fetus, meconium and the amniotic fluid, abnormal uterine contractions. Pathology of Cytotec, in gynecology. Vaginal route. Vaginal tablets. Cervical maturation and induction of labor at term, especially in cases of immature cervix as long as there are no fetal or maternal contraindications, 25 micrograms at 4 to 6 hour intervals, up to a maximum of 100 to 150 micrograms. Dilation of the cervix of the non-pregnant uterus prior to hysteroscopy or other gynecological procedures requiring access to the uterine cavity, 400 micrograms 2 to 8 hours before, in uteruses with no history of previous C-section or uterine scarring, and 2 to 4 hours before, in uteruses with the history of previous C-section or uterine scarring. Vaginal release system. Induction of labor in women with an unfavorable cervix, from the 36th week of pregnancy, in which induction is clinically indicated, controlled release system that releases misoprostol at a rate of approximately 7 micrograms every hour for 24 hours. Maximum dose of a vaginal release system, 200 micrograms. Mode of administration of Cytotec. Vaginal delivery system, administered by staff with obstetrics expertise in a hospital where facilities are available to allow continuous fetal and uterine monitoring. The condition of the cervix will be carefully evaluated before using Misodol. After insertion, uterine activity and fetal condition will be monitored regularly. Contraindications of Cytotec. Hypersensitivity to misoprostol, to prostaglandins, when oxytocic drugs are contraindicated or prolonged uterine contractions are considered inappropriate. Cervical maturation and induction of labor at term. History of cesarean section or major uterine surgery, cephalopelvic disproportion, clinical suspicion or evidence of pre-existing fetal distress, history of difficult or traumatic delivery, multiparous women with 6 or more previous full-term pregnancies, transverse fetal situations, obstetric emergencies when the risk-benefit ratio for both fetus and mother warrants surgery, multiple pregnancies, unexplained vaginal discharge and/or irregular uterine bleeding during the current pregnancy, patients in whom vaginal delivery is not indicated, such as with placenta previa or active genital herpes, concomitants of oxytocin and other stimulants of uterine contractions, risk factors for amniotic fluid embolism, severe preeclampsia or eclampsia, induction of labor in women with unfavorable cervix, from the 36th week of gestation. When labor has begun, when there is suspicion or evidence of fetal distress prior to induction, for example, unsuccessful or failed stress test, meconium staining of amniotic fluid, or diagnosis or history of non-reassuring fetal status, when there is suspicion or evidence of uterine scarring resulting from previous uterine or cervical surgery, for example, cesarean delivery, when there is uterine abnormality, for example, bicornate uterus, when there is placenta previa or vaginal bleeding of unknown cause after 24 weeks of gestation in the present pregnancy, when there is fetal malposition, when there are signs and symptoms of chorioamnionitis, unless appropriate prior treatment has been instituted, before 36 weeks of gestation. Warnings and precautions with Cytotec. Epilepsy or history of epilepsy, renal or hepatic disease, cardiovascular disease, hypotension, history of cesarean section or major uterine surgery, with hemostatic disorders accompanied by hypocoagulability or with anemia, chorioamnionitis, infection of the placental membranes and amniotic fluid, hydatidiform mole and intrauterine fetal death. Not recommended in renal failure, liver failure, malnutrition. Increased risk of postpartum disseminated intravascular coagulation in patients who have been induced to give birth by a physiological or pharmacological method. Vaginal release system, misoprostol can cause excessive uterine tachysystole that may not respond to treatment with tocolytics. Perform close monitoring to ensure removal of the vaginal delivery system immediately at the start of labor or if uterine contractions are prolonged or excessive or if there is a clinical complication in the mother or baby. Misoprostol is used for induction of labor at term, at low doses for a short period of time. When used at this time of pregnancy there is no risk of fetal malformation. However, it should not be used at any other time in pregnancy. A threefold increased risk of fetal malformations, including Mobius syndrome, amniotic band syndrome, and central nervous system abnormalities, has already been reported in pregnancies exposed to misoprostol during the first trimester. Liver failure and Cytotec. Caution in moderate or severe liver failure, increased AUC, Tmex, and THAF have been observed, but no pathologic readjustment seems to be in progress. Renal failure and Cytotec. Caution in moderate or severe renal failure, increased AUC, Tmex, and THAF have been observed, but dosing does not appear to be adjusted. Interactions with Cytotec. Potential effect of oxytocin. Inhibition of the anticoagulant effect of acenocomerol. Potentiation of toxicity at neurological level with phenylbutazone, naproxen and abdominal pain or diarrhea, diclofenac, indomethacin. Increases frequency and intensity of diarrhea with antacids. Administration of laxatives, intense diarrhea. Pregnancy and Cytotec, in gynecology. Cytotec, at high doses, produces an increase in congenital anomalies in rats and rabbits, including anomalies in the upper and lower extremities and in the CNS, the period of greatest sensitivity being between the first and second month of pregnancy. It has been observed that misoprostol has an embryotoxic effect in rats and rabbits, and any dose that produces a sustained increase in uterine tone may endanger the embryo or fetus. More than 35 types of abnormalities have been described in children exposed to misoprostol during the first trimester of pregnancy, which can be categorized by anatomical groups. The most frequently described defects were those corresponding to the lower extremities and occurred in 4/5 of all cases. More than half of the cases presented anomalies in the central nervous system, while 2/5 and 1/4 presented anomalies in the upper extremities and in the skeletal system, respectively. 2/5 of the cases presented other anomalies such as defects of the genitals, eyes or palate. Effects have also been reported on children of mothers who ingested misoprostol in a failed attempt to induce an abortion. Among the most common effects are Mobius syndrome, congenital facial paralysis, and defects in the extremities. Still, the absolute risk of suffering from this syndrome is relatively low among women exposed to misoprostol during the first trimester of pregnancy. Breastfeeding and Cytotec. It is excreted in breast milk, but its concentration is negligible within 5 hours of administration. Effects on the ability to drive by taking Cytotec. Not relevant.